We sent two staff, ICU staff, to the National Teaching Institute Convention and Critical Care Symposium in Chicago. And when they came back, they were able to tell their peers about their experiences, and that actually triggered a lot of education interest from their peers. In order to make good use of the remaining funds, we contacted, with the help of our EICU in Sacramento, we contacted two national speakers, Barbara McLean, which is internationally known, and also Tom Ahrens, which is a nurse researcher, a scientist, nationally known as well.
The level of expertise that we were able to bring in most definitely would not have happened without the gift from the Russo family.
And then Tom Ahrens also taught the computer simulation with the nurses.
The education piece was focused on raising their critical thinking and how to apply that critical thinking to an intensive care patient.
We used the simulation for our new hires also, that within their 90 days upon hiring, they have to undergo this competency. And that triggers a lot of interest of becoming nationally certified for critical care. When I started in 2010, there was nobody who is nationally certified, nobody who is a clinical nurse 3. Now we have 4 clinical nurse 3, and then we have 10 nationally certified critical care nurses.
They're challenging their ability to, be better clinicians and, not be complacent at the bedside. They know that, they're partnering with families, they're partnering with patients, they're doing bedside reporting, at the bedside, engaging the patients, engaging the families. I think it really is shifting the culture in the entire hospital.
We have one patient in our room 5, and which the patient was sedated. We wake him up, and then we found out that he was able to cooperate with us.
He was still intubated. He was awake, but he wasn't ready to be extubated just yet. But we wanted to get him up and walking, and we did.
And the patient was ventilated, but that is with the cooperation of everybody that are included in the care of this patient, like the RT, the physical therapy, the nurses. Amar was there, Dr. Lu was there. And so, and the bedside nurse was there. And so it's a collaboration, it's a teamwork.
But it was amazing. I believe that same day, after getting up and walking, and we had him off sedation, he was extubated that day and was out of our ICU by the next day. So we're seeing a lot of our patients doing that now. This will become now a standard of care as far as monitoring our patients for delirium, engaging them, as far as progressive mobility.
The patients that we see now are very different than the patients that we saw even 5 years ago. They're more sick, and so it was really important that our nurses had the skills and the level to be able to take care of these patients. We definitely would not have been able to have provided the level of education that we were able to provide.
We will see our patients with less length of stay in the ICU, as well as less time on the ventilator. They'll get better sooner.
And I am very proud of the nurses that work in the ICU right now, because it's a 180 degrees change. They change a lot.